treat total knee replacement or total knee arthroplasty. You've decided that you need a knee replacement, you've seen your orthopedic surgeon, and now we're getting prepared to have that surgery because you have pain, you have limited function, you now have to use an assistive device. So now we're going to get prepared for the surgery. Preparing for the surgery, there are exercises that you can do. Sometimes doctors will send a patient to physical therapy, or they will send a home health therapist in for a one-time visit so that you can learn some exercises to help get prepared for your surgery. Because if you do the exercises prior to, it increases your muscle memory. Your muscles wake up a little bit faster following, and they'll perform the activities. And it'll also be less painful because your body is used to doing those exercises. Following having your knee replaced, you should have a nurse and or a physical therapist come to see you at home, do a safety evaluation, make sure there's no safety issues like throw rugs, stairs. That's where I come in. I teach some exercises. Of course, these exercises that I'm going to give you. In addition, I go in and I help you get up and down your steps, teach you to get in and out of your bed, because these are things that you have to do. So a few things just prior to, so following your surgery, you're going to want to make sure that you've been given medication from your doctor. You want to make sure that you utilize that medication, because that medication helps you control the pain so that you can tolerate being able to do your exercises. In addition, that medication helps you with your rest. And rest is so important because when you sleep, if you have pain, you're going to toss and turn. You're not going to get that rapid eye movement. That rapid eye movement sleep is when your body is regenerating and repairing itself. And that is so, so important for following a surgery. Nutrition is also extremely important. You get your vitamins and your minerals from taking in your fruits and vegetables. And also you need some lean protein. I recommend all of my patients get a whey protein supplement because that helps with the healing of that replacement. It helps healing that tissue. You know, that incision itself is going to take up to a year to completely heal. So that whey protein makes a big, big difference. Also, following your surgery, you're going to want to make sure to ice that knee. That knee has the incision on the top, right on the front, but you're not only going to ice that front, you're going to ice all the way around that knee. So top and underneath. So having the ice pack on top of the knee and under the knee is very, very beneficial because the whole knee was replaced. The top of your tibia and the bottom of your femur completely has been replaced. So they go in this way, but it's the full knee that's been done. Also, elevation. So you want to elevate that leg up above the heart. So if you're lying down, by placing a pillow underneath that knee to get it up above the heart. So you might have to go even a little bit higher, a couple pillows underneath, make a very big difference because that allows the drainage of the fluid that is in that leg to come back down to your kidneys and you can expel. So you want to get rid of that fluid as soon as you can. So the exercises I'm going to give you today are exercises that should and can be done 4 to 6 weeks prior to your surgery to make things much more beneficial after your surgery. But these exercises are actually the same. So when you get finished with your surgery, pretty much that same day. If it was early, that same day, these are the exercises that are going to be given to you. These exercises should be done 3 times a day, and you should build the repetitions up to 30 reps each. So at first you might be only able to do 10, maybe 15, but 30 reps is really that magic number. So the first exercise that we're gonna do is called ankle pumps. So you're going to point the toe and lift the toe up, nice and controlled. It doesn't really have to be held any certain amount, but we want to increase the circulation, and that's what this exercise does. So also, following a knee replacement, you need to get that knee bending. So you want to do heel slides. You're going to bend that leg up and you're going to slide it out. And of course, I have that normal range of motion. So normally you're here and you're really trying to pull, but we can't quite get it all the way up. So you're just working to get that range of motion back. You can also use a towel to stretch. So you would just place a towel around that toe and you can use it to aid in bending that knee. So you can hold it, a good stretch is 30 to 60 seconds, but we don't want to do that completely because we want to build up the strength in your hamstring, the back of that thigh, and then also in that quad. Your next exercise would be what we call terminal knee extensions. So a ball or a little pillow can be placed underneath that knee, and we can do the terminal knee extension. So we press the back of the knee down into the ball, and we just lift that heel up. And it's very important to push that knee down into the ball. The next exercise would be a quad set. So it's where my leg is flat, and I push the back of my knee into the mat, and I tighten up that thigh, and then I release. And again, I press down into the mat for that quad set and release. Again, not really necessary to hold any certain period, maybe 3 seconds, but as long as you have that controlled motion, that's what we're looking for. So another exercise is abduction. So really it's just sliding that leg out to the side and back. So we slide that leg out to the side and back. You can also do both legs at the same time, and we can just do a snow angel. So sliding the legs out and then bringing them back together. And another very beneficial exercise, but it is a little bit harder when you first get your knee replaced, is a straight leg raise. So I always recommend my patients bend up a knee because that takes the pressure off the back, especially if you're lying back on a pillow. And then you're gonna keep this knee locked out straight, lift from the heel, and we lift up and lower. About 6 to 8 inches up off the table or off your bed is where we want to be. And again, we want to build this exercise also up, 30 repetitions, and we want to do them 3 times a day. Very, very good exercises to prepare for your total knee replacement, in addition to do them following your knee replacement. And of course, things get advanced beyond these exercises, but at first, these are the most important ones, and I don't advance my patients until they get 30 repetitions on all these. Another thing that is very important is when you go home, you have trouble getting that leg up into bed. Very normal. So it takes sometimes a week, maybe 2 weeks, to be able to lift that leg up into the bed. But that's where the straight leg raises come in and assist. You can always use your good leg underneath and use it to lift up into bed and out of bed. Sometimes they will provide you with a little strap, but if they don't, You can always utilize a towel, a sheet if you need something a little bit longer. You just place it on the toe, keep that knee nice and straight, and use your arms to lift up in bed. And then you can do the same thing, have that towel available so you can toss it around that toe, and you can use it to assist getting out of bed. Hopefully this helps, and hopefully this is preparing you for your surgery. Take care, see you soon.